Roxo Media House.
Welcome back to FORTitude, everybody. JW, Brenton, how you been, man? Captex, baby. Captex Studio. Thank you, Captex.
I've been
Mike
good.
Thomas, you're going to love this episode. How you been, buddy?
We've been good.
Good. Well, due to popular demand, our Cannabis 101 episode went so crazily well. We had a lot of good feedback. We brought another guy in here, a little different topic, but along the same lines. In front of us today, Brenton, is Jim Smeeding. This guy's well pedigreed. Jim, thank you for joining us.
Absolutely.
If you don't mind me, I'll read a couple of things so people get a sense of who you are and who you were. But you're a former executive director of the National Association of Specialty Pharmacy, founder of the Center for Pharmacoeconomic Studies at the University of Texas College of Pharmacy. You have a pharmacy degree from the University of Buffalo and an MBA from the UT. We won't hold that against you.
Yeah, I was going to say you horned frog people
Right.
over here.
Original founder of the International Society of Pharmacoeconomics and Outcomes Research, which has more than 15,000 members currently, and you've worked with all major pharmaceutical companies. A founder and president of the Indication Biosciences at an early age stage drug discovery company.
Yep.
Phenomenal. And last couple things real quickly, research as a founder of Canna Pharma RX and member of the board of directors for Allied Health and VP of Pharma and chief scientific officer.
Yep.
So to put it mildly, Brenton, he's been there and done that, and he knows a few things about this world.
Do you know anything about pharmacology by chance?
Yeah, of course. I mean, pharmacists in general have some training in that area, and as JW's already pointed out, I have a kind of a broad scope of pharmaceutical development, use of pharmaceuticals. I was the chief pharmacist for the city of Austin, Texas, so it'd be like over here in Fort Worth, whether it be John Peter or
Smith
or Texas Health Resources,
Yep.
the big house here. So managed a lot of that, developed my own orientation towards the pharmaceutical industry in the late 80s. And then some of my companies, we've basically worked for, I always tell people, started Abbott and finished at Zeneca. I've done work for them. So pretty much A to Z. And successful entrepreneurial activities in a lot of different areas. As JW mentioned, I have my own drug development company right now, which uses CBD with the lipid lowering agents, Lipitor, Crestor. We're working that forward. And on Allied Health, which is a cannabis-based company out of Kelowna, British Columbia, we have a strong penchant towards treating patients that suffer from post-traumatic stress disorder, PTSD. And along with that, anecdotally, some of the people who are using our cannabis products said, psilocybin mushrooms would really help us get over the hump, and we're already taking it in terms of natural health orientation and availability and kind of the gray market in Canada. But again, no big surprise.
Which is the reason, Brenton, Jim sits in front of us today. Today's episode, we're going to learn about psilocybin, otherwise known as
Mushrooms.
Yes.
How many dead shows you been to?
Golly, I've probably at least probably 6 or 7, I believe. And again, when you get busy in life, it's hard to get on the train all the time and make all those shows. But certainly enjoyed my experiences. I was talking a little bit before we got started here about going to Woodstock.
Which
original.
99 Woodstock
the
99
original
with Limp Bizkit?
Woodstock. No.
He saw Hendrix. Do
We're
this, the anthem.
talking 1969.
Tell us that story. That was, please.
You like that story?
Yes, I love it.
So again, it's interesting to me. I've talked on occasions about various things. I've given actually lectures on cannabis when it was first coming into legalization, recreational use, what have you. And it's hilarious to me because I'll tell this story. So I gave a lecture to 600 people out in Las Vegas that were there for some kind of a money investor show. And they asked me to talk about cannabis. And I said, well, I'm going to talk about what the realities are in terms of legalization, what have you. So, everybody in Nevada is getting real cranked up because they say, hey, not only are we going to get medical, but sooner or later, it's going to get legal here. Mm-hmm. So there's a lot of happy people in the audience going, yeah. And I can tell you, if you haven't been to Vegas recently, I would say Vegas is certainly the major capital city of the cannabis industry these days. I mean,
It's totally legal, recreational, and
yeah. In fact, I went out to the MJ Biz conference, which is the largest conference around that last year, and there were 26,000 registrants, and they filled up every single space that you can fill up in terms of exhibit hall at the Las Vegas Convention Center. So it's obviously a huge business. In Vegas, it's not unusual to have stores that'll do upwards of $15 million worth of sales a year. So you get the idea. But the reason I related that is because the fellow who was the moderator at the show, he said, well, I've been to, I love fish, the fish. And, so when I got up and, I said, well, if that's your only credential, I went to Woodstock. I took the green acid. I went to my first date with my wife was to a Grateful Dead concert. So clearly I'm the expert in the audience here. So, enjoy the rest of the ride. So again, I enjoy discovery. I think I've got a lot of credibility within the pharmaceutical business itself. I understand the regulatory side of things. I understand the scientific side. And I also understand the economics. And I think that all kind of plays into psilocybin we're going to talk about, but hallucinogens in general and how this market has really come alive. And I related a little bit earlier, I also deal with the payer community in healthcare. And I think everybody knows when you go to get a prescription, the big question is, how much is this going to cost me? That's based on your benefit. And the benefit is, of course, deliberated and approved by medical professionals within insurance companies. So the whole idea of how do I get care, how do I receive care, what's going to get paid for, what is it going to be paid for, it's based on a lot of science, the development of standards of care and all kinds of things that kind of fall into, is the patient really getting benefit from what we're paying for? So value in healthcare is fairly significant. Again, JW mentioned I'm the founder. I founded the Center for Pharmacoeconomic Studies at the University of Texas in Austin, and I'm the third president and one of the founders of the International Society of Pharmacoeconomics and Outcomes Research. What you find out is no matter where you are in this globe, no matter what country, no matter what political orientation, everybody wants to know what's the value of the dollars we spent in healthcare. It's really a measurement of quality over cost, and quality meaning effectiveness over the cost of it. So all relevant to new medicines, old medicines, natural medicines like psychedelics, psilocybin, and, fun to talk about today.
Sure. Well, let's refine our scope for today's discussion, if you don't mind. Psilocybin, magic mushrooms, as Britton very eloquently pointed out, and probably grew them in his college closet.
Well, I actually did buy a psilocybin grow kit when I was at the University of Washington back, I guess, about 40 years ago, and I actually grew little mushrooms, and you bought the spores and stuff. It was kind of an interesting kind of home planting orientation.
JW's familiar with it because he got the fungus in between his toes at the locker room there.
We've got medicine for
that's
that.
your jab. I deserve that. I deserve that.
Right back at you, my friend.
All right, Jim. Let's start off simply. What is psilocybin, and why is it something that we know as mushrooms? What's the story with that?
Well, again, there's a lot of functional mushrooms, psychoactive mushrooms that are available. Some people, for example, find benefit from lots of different fungi. Lion's mane, cordyceps, etc. So, and there are, in the Pacific Northwest, there are whole food orientations, whatever, where you can go in and buy functional mushrooms. Psilocybin, however, was, of course, qualified a number of years ago as a Schedule I medication, which meant that it had no therapeutic benefit. And I think that was really based on the fact that there's probably politics behind it, but nobody had really done the research. So you had, obviously, Native Americans, these are natural medicines, utilizing these and obviously gaining some insights and benefits in religious rituals, things along that line. But we know that psilocybin acts at the serotonin receptors in the brain. So it's a serotonin agonist, which means that it mimics serotonin in the brain. And the receptor sites that psilocybin, or its analog psilocin, which is the active ingredient psilocybin, has some hallucinogenic benefit, but it also has some stimulating benefits within the brain. So I think understanding a little bit of the science behind why hallucinogens work, why in all of them, whether it's be MDMA or ecstasy as we know it, ayahuasca, ketamine, they all work at basically the same serotonin receptor sites in the brain. So that's kind of the key target area.
So what is happening when it's mimicking serotonin? Explain what serotonin maybe briefly, and then
sure.
why is it doing what it does to
so
people?
At the receptor sites, serotonin, and we know if you think back to Prozac, which was a selective serotonin reuptake inhibitor. So it was an antidepressant, and it was not an agonist, but an antagonist. So it would basically work at the same receptor sites in the brain as psilocybin would. And there's some interesting studies going on right now with SSRIs, selective serotonin reuptake inhibitors, and psilocybin or MDMA at the same time. So it activates these sites in the brain. And to go layman term here, these are happy sites.
Yeah.
These are things that stimulate imaginative thinking, allow people, perhaps they're in a depressed or a treatment-resistant depression orientation, to have some better thoughts, happier thoughts. And therefore, psilocybin, over the years, of course, became popular, Simple Simon, or whatever you wanted to call it. I myself have taken psilocybin and mescaline and a couple other things.
You don't seem depressed, though, Jim. Is there another reason?
It's interesting. I don't know whether it's just my normal happy nature, but I'm just not a depressive kind of guy. But I suffer for people with mental health illnesses who do have these depressive types of maladies. And, we know that these are significant. In fact, in the U.S. market alone, it's estimated that we spend $240 billion a year on mental health care, and most of it, I think, one would suggest, is reasonably ineffective.
Yeah.
And we turn people into kind of zombie orientation. We give them doses of things that don't make them happy, but seem to actually more or less make them unfeeling or numb and what have you. And that's certainly not what we want to do. And I think psychotherapists and others, in particular in the last, I'd say 4 to 5 years, have started to realize that maybe what we were talking about in the 60s was a valid medication orientation that we needed to move to. And therefore, I think that's why we see the explosion, and I mean explosion, in companies and people now going back and reevaluating the opportunity to use psilocybin, MDMA, and sooner or later we'll see LSD and some other things as well, utilized in a manner that we hope improves mental health and decreases some of the abuses today.
Go ahead.
Well, I get so many questions, but one is, you talked about the SSRI.
Yeah.
To like the simplest form, what is that doing from the antidepressant standpoint versus like the psilocybin, right? Like, just if you're explaining to a real novice,
neuroplasticity, all this stuff.
I'm
not going to get into, but let me just say that what we know is that, and this is probably more hypothesis and therefore it's under phase studies with the FDA, what have you, is that psilocybin, where it seems to interact most effectively, that it almost acts to kind of rewire some of the broken circuits. If again, to try to make it as simple as possible, SSRIs, Prozac, and all of its other analogs, what have you, certainly also work, and in some patients they work reasonably well. But in some patients, they do nothing in terms of, so there's a question about whether it's really helping to rewire things or whether it's just acting as an exogenous, something that is mimicking serotonin but not actually activating it. And I think that's kind of the key, is that these natural medicines that we're looking at seem to have the benefit of actually stimulating what I'll call, again, kind of better circuitry, better rewiring in the brain, as opposed to just supplying something that we could naturally produce with the right orientation.
Right.
Yeah.
For someone who has never done mushrooms before,
Sure.
what's to be expected? Obviously, it's a dosing question as well, but what are some of the side effects one might get from psilocybin?
So again, first of all, let me say this, that, I think hallucinogens, part of the reason that in the 60s and on they were scheduled is because they were being used recreationally. And I don't think, it's no different than recreational cannabis, or if I was sitting here and having a beer with you guys. At a certain level, it becomes a personal choice. But I believe that the hallucinogenic side of this business and the way that this is going to go is it will be prescription. It will be, therefore, have certain indications, and it will require some prior knowledge and care associated with caregivers as well as patient education. And I think that's kind of where I want to go a little bit, is that what happens when you take psilocybin? Well, it is dose dependent. So I'm working on some microdosed applications, which most people say, oh, that's just placebo. However, there is some evidence contrary to that there is some long-term benefit. But a journey dose, something that you will want to have some knowledge of what you're entering into, oftentimes some coaching, and which is now required by some of the states that are decriminalizing or authorizing the use of psilocybin, is that, you've got to understand you're probably going to lose your ego kind of orientation. You're going to have some kind of disassociation, and to try to make that a happy disassociation is important as opposed to a paranoid one. Yeah. So feeling uncomfortable is not an unusual side effect. A little anxiety going into it, even though psilocybin will eventually be used as an anti-anxiety drug.
Right.
Some understanding of how that discomfort can be managed. The knowledge that you're in a safe place with people that care for you and care about you. The fact that this will not go on forever. That this will be something that you will metabolize and move through and re-enter your normal process, hopefully with a little bit of a better outlook in terms of what's going on in your life. So I think, understanding what you're going into, understanding that you're taking a journey dose, which I said is about 25 milligram. It's orally active, changes in the body to psilocin, and it's absorbed into the brain, serotonin, receptor sites, etc. So, I think that's a reality that people need to have, and I think the safety issue around it is exactly why, if you take a look at Oregon, Colorado will go the same way, that basically you have to be in a caregiver-associated atmosphere, and the caregivers will be regulated. So it means that you will have to meet some minimum requirements. It's also interesting at the state level that, for example, in Oregon, which of course was 2 years ago, they're finally getting it figured out. It's been a long time coming, but municipalities can opt out of the program. So if you really take a look at a map of Oregon and where mushroom therapy will be allowed, it's basically the big cities, the university towns, as you might imagine, a lot of the smaller areas and stuff for various reasons. And I think there's a fair amount of bias, again, still, as there would be with marijuana, what have you, is that they're opting out of being involved. So, but at the same time, I don't know if people know this, but mushrooms were decriminalized in Washington, D.C. You can go and buy mushrooms. You can't say, I'm here to buy mushrooms. You have to say, oh, I'd like to see what the gifts are that I can receive for spending $50 on a plaque of Donald Trump or something. And that's how it works in D.C. That's the same with cannabis. It has to be gifted, but you can buy a gift. And then part of the reward is that you also receive cannabis or mushrooms. So it's a kind of interesting how we work around the interpretation of the laws. I think most people don't know, but Texas, yes, the great state of Texas is actually very interested in the use of hallucinogens for mental health. In fact, they authorized the University of Texas I won't go into hook 'em horns or anything, but the University of Texas has a Center for Psychedelic Research now. Johns Hopkins University, University of Wisconsin, NYU in London, the UK, I can't remember, but there's a lot of global interest in hallucinogens.
Seems to be following the cannabis movement. Maybe it's obviously a few years behind, but it seems to be catching steam year over year.
It actually is moving quicker in a certain lot of ways,
right.
J-Dub, and I think it's because you got to think about, again, here we are, and we know that investment drives innovation. Investment drives, motivates people to do things. So 50 publicly traded companies now in hallucinogenic medicine, 40 private companies, a lot of, again, research, treatment centers, wellness, what have you. They're all moving into this area. So that's stimulating it. The fact that we don't have good answers for mental health, what we currently use from a pharmaceutical perspective today, is driving it. And, it does have parallels to cannabis in terms of how it will roll out on a regulatory basis, but the FDA will never, ever, and I've said this 5 years ago and I'll say it again today, will never really authorize full spectrum marijuana as being a drug. They can't. It's too complicated. There's 450 minor components, 86 major components, and you can't study that effectively. You can isolate psilocybin. You can isolate MDMA. So now you know exactly what you're giving to a patient and what you're treating. You can run randomized, double-blinded controlled trials, which are what they require to go through phase research for FDA approval. So the FDA will never approve cannabis. The FDA will certainly, and you can take it to the bank, that they will have approved hallucinogenic medicines of various sorts somewhere over the next 2 to 5 years.
Oh, wow. Fascinating.
Yeah, and moving quickly. Right now, investment in the hallucinogenic space right now, 2021, $3.1 billion, 2028, 7 years, predicted to be somewhere in the neighborhood of $8.5 billion. So it's a big market out there. You can take a look. You can take a look at the number of studies that are going on out there, and these are FDA-approved studies. The other thing that's interesting to note is, first of all, the DEA, Drug Enforcement Agency, has actually increased the quotas that they will allow people to produce of materials for testing in this particular marketplace. It's what I'll call another buying sign.
Sure.
Biden-Harris has bills that will allow more research on controlled substances that are considered to be Schedule 1, which is where psilocybin, MDMA, what have you. So more interest there. NIDA, the National Institutes of Drug Abuse, who, whenever you went to them with a cannabis trial that had a positive outcome, they would not fund it. They are funding studies right now for the use of hallucinogens for tobacco cessation smoking. So, again, you take a look, all the regulatory signs are there. The scientific evidence is building that this is a much better way to approach this. And you can pretty much, again, I don't have to be Houdini to suggest that there's magic out there. It's going to happen.
Yes, sir.
Why? Is it because all the people who went to Woodstock are in power now? What's the reason for this?
I think there's more enlightenment about what, again, the negative side of it, what hasn't worked, major antipsychotics, antidepressants, the cost of mental health in this country, what have you, suicide, post-traumatic stress disorder, and so forth. And I think there's a realization that if there's something that could scientifically be proven to be beneficial, we ought to go after it. So again, it's not necessarily a liberal, a Republican, a Democratic, a libertarian issue. I think that, at a certain point, everybody coalesces that if there's a discovery that makes sense and improves patients' health, that we ought to consider it. And when you take a look at the burden of mental health illness and the cost to society, you got to say, hell, what we've been doing isn't working. I think we really ought to try it.
Yeah. I mean this as a serious question,
sure,
but not in besides people's closets where they're growing these things through kits. where do you find these type of mushrooms on the planet? Where do they grow?
Well,
and what makes them magic? These ones, right?
Yeah, psilocybin. So there's a lot of different strains of psilocybin, which of course helps you. I should say, it causes you to have to do some standardization and some things like that. There's been some activity of you can synthesize, and I can tell you some major companies, former divisions of Johnson & Johnson, for example. There's a company called Puricis. And Puricis is synthesizing all the cannabinoids. In fact, I'm going to be a customer of theirs buying CBD for my pharmaceutical grade product, but they also have done the same with psilocybin. So you can synthesize it, you can grow it. Interesting enough, the major growth, it's a growth marketplace as well, is in Jamaica.
Does it grow naturally, or does it have to be cultivated?
No. Well, it does grow naturally. If when I was at the University of Washington, after a particularly rainy season, what have you, watching students crawling around in the grass on the mall looking for little psilocybin mushrooms. Yes, it does grow
through cow manure.
Well, not necessarily. Well, the cow manure is certainly one of the substrates that works, but it's also as much if you chop down a redwood tree and let it sit for about 10 years, it kind of starts to degrade, and that's just perfect growing area for fungi in general. I mean, you see it when you go anywhere where there's forest and rain. At a certain point, you'll find fungus growing somewhere. So, I think it's interesting. So where do you find it? So one of the ways that Allied Health and I got interested in it is that there was a little company, Gray Market, up in Vancouver Island, who is selling ground up psilocybin in small doses with a couple of other functional mushrooms, lion's mane and cordyceps, as I said. And they were selling it. And by talking about effective doses, they were selling like, I said 25 milligrams of effective dose, 2.5 milligram doses that they were selling. And people could buy 10 capsules for $20 and they'd ship it out. And this is where we started getting reports from vets who are using our product, as well as first responders, of which that includes the law enforcement, emergency medical technicians, what have you, that were suffering from traumatic stress associated with their jobs or the war or what have you. They started reporting that, the cannabis helps, Jim, but quite honestly, this mushroom stuff is really kind of, I've stopped drinking as much. I'm not taking pain medication. I'm sleeping better, so on and so forth. So, it's those kinds of reports that sometimes give you that empiric feeling that you ought to move forward and explore this a little more because there is something happening and it's good.
Yeah.
So
the paranoia, we're talking about all the benefits and stuff. What happens when you get that one patient that just gets like they go crazy from it?
Well, again, it's interesting. Obviously, there's lots of thoughts. Schizophrenia is a very different disease than depression, what have you. And so there's some concerns that people that have other major mental disorders, it may not be beneficial. I think that requires proper research and control and what have you. So, paranoia, I mean, I remember driving down the road one night with my wife and we picked up a hitchhiker and it was a New Year's Eve and I think we had ingested a fair amount of cannabis as I remember, and the guy gets him back and we're driving down the road and he's like, oh, dude, there's a cop up there. So I'm like, do I get that joint out of my pocket, swallow it, whatever? So, people can induce paranoia pretty easily when you're in what I'll call a altered state. Yeah. And cannabis has the same capabilities.
Where did that cop end up being? A streetlight?
Like a tree?
No, not, needless to say, I told, this may sound cruel or unusual, but I pulled over at the next stop sign. I said, it's time for you to get out. But whatever. It's just, paranoia is easily induced in people.
Yeah.
And so if you
don't say, I've never experienced that ever here at this show.
Yeah.
Why are the police here?
Certain people bring it out of me a little bit more than others.
Yeah. We've all heard the term, Jim, the bad trip, having a bad trip.
Sure.
What does that mean, and what's going on?
Well, I think
this is part of it, right?
Well, again, if you take a look at it, and it is part of it. Again, you could sit, like I said, with 500,000 people at Woodstock, and you took the green acid, and they just told you over the loudspeaker, anybody who's taking the green acid, you may want to come to the health tent here. And so I'm sitting with 4 other people, and we're all saying, how do you feel? How do you feel? How do you feel? And I'm, of course, saying, I'm doing the coaching stuff, saying, I feel pretty good, so I think we just kind of chill here, guys.
And you did, and what happened?
We had a great afternoon. We heard some amazing music.
Yeah.
We partied on it late into the night, and the next day we woke up and said, man, what did I do yesterday? I'm like, really? But at any rate, so again, I think paranoia is a controllable and a safe place with coaching and an understanding. I would never, ever suggest that somebody just go and take a hallucinogen without some knowledge or understanding, or, again, being in a comfortable place with friends, people that they understand. And, I've had friends of mine freak out where they, ate a brownie that had a little too much THC in it, and when they beg you to go to the hospital, you could take them. But at the end of the day, it's like, we're just going to sit here because a few hours from now, you're going to feel a lot better.
Yeah.
And then the other thing about that whole suspension of kind of hallucinogenic bliss, what have you, is, again, this ego and id thing is important. Mm-hmm. I mean, if you go into it and you're already uncomfortable and paranoid and what have you, if you go into it like me, where I'm stable, comfortable, secure, what have you, it's probably going to be a slightly different experience. And I've certainly had friends and stuff who've had proverbial bad trips, but the bad trip was just something that we needed to kind of let nature take its own time and move on through it.
Is a bad trip just somebody freaking out, like you said, or is it like not being able to sleep for a long period of time?
No, I don't think it's so much. Obviously, again, you've altered a bit of your serotonin and things like that. I think it's mostly, I'll call an episodic anxiety-associated problem. I mean, again, as we know, this is one of the issues with recreational as opposed to control use of anything, is that, you take too much of something, or you decide to supplement it with something else, or you don't know what you're taking.
The wrong kind or something.
I mean, these are all the dangers, and it's why really I think the benefit of some regulation and regulatory compliance and some production-related controls of quality, what have you. And I hate to say this, but 6,000, 7,000 products are in the marketplace right now that have CBD in them. How much? Still good. Expiration date. What else is in there? Who knows? Kind of stuff. It's because the FDA has not actually ever gotten into it. Once they finally do, I would bet you right now 50% of the products that are in market today will be analyzes mislabeled, meaning it ain't what it says it really is in terms of amount, things like that. It's that's the natural health side of it, and while everybody wants the opportunity. And again, I'm a pharmacist. I understand all the good thing about pharmaceutical companies and all the bad things about pharmaceutical companies. So, but the one thing that they do is they're held to a standard to produce safe and effective products. Natural health products, it's the Wild West out there, and it's problematic from that standpoint. So while you can say, well, CBD is not going to kill you, what have you, I would agree with that. The lethal dose is, you'd have to, consume half a truckload of the stuff, et cetera. Doesn't even exist. MDMA, psilocybin, LSD, what have you, there are some limits in terms of what's safe and to be effective. So you'd want some control over that in terms of some assurance.
Sure. One of the reasons I reached out to you so long ago to get this set up to talk, I remember several years ago, I liked the show 60 Minutes, and they showed the story on a study where they had 100 people lined up, in a controlled environment. They gave them a measured dose of psilocybin. They'd have somebody watch them and all these things, and then they would interview them after the fact.
Mm-hmm,
and this is what got me thinking about all this. But I remember distinctly this woman going on there, and she's weeping, Jim. She's crying, and they're like, she's like, I saw my deceased parents from 30 years ago, where I had the most profound time of my life. During this episode, and I remember asking my wife, "Hey, if somebody can guarantee you'd have one of the most profound moments of your life, isn't that worth trying?" And she ultimately said yes, and she's never done it. But it's incredible. If you could tell somebody you could have this profound moment in your life, you could revisit people maybe you haven't seen forever and come out of it weeping because you had this experience. Like that's powerful stuff.
Every idea and investment usually has a story behind it.
Mm-hmm.
And I can tell you right now that many of the people that have gotten into this on a investment basis, what have you, they have a story, whether it's about a loved one, their son, their child, themselves, that they've gone through and they've had a good experience, or they've improved the lives of their kids, whatever, because of it. They become, I'll call it hallucinogenic enthusiasts. Mm-hmm. And they want other people to have that experience because it's been a good experience for them. So I don't find it unusual that if somebody kind of has what I'll call a breakthrough experience that they found beneficial, hell, of course they're going to recommend it to other people and they're going to want to approach it. So, again, I think we're going to see opportunities as we move forward here with more research. And, the list is long of applications for hallucinogens in medicine. Obviously, treatment-resistant depression, major depression, but there's all kinds of other things from fibromyalgia to, it goes on, smoking cessation, alcohol dependency. There's a lot of studies, and these are good studies. These are FDA-approved studies. These people went through investigation review boards. They're designed the statistics of the study. So, in the FDA pathway, there's 4 phases, phase 1 through phase 4. Phase 3 is your pivotal trials that show the effectiveness, what have you. Phase 1 is usually first-in-human studies just to show there's some safety. Phase 2 are usually dose ranging as well as continued safeties. Then phase 3. And then phase 4 you found out that you not only have a product that works, but it might be good for something else, so you want to test it further and see if it's good for it. But we're going to see a huge amount. And there's, the MAPS people, I don't know if you know what MAPS is, Multidisciplinary Association for Psychedelic Studies. They've got some very good evidence now on some of the MDMA work that they've done, and they're all the way into phase 3. And like I said, you got, everybody, highly respected health providers, University of Washington, University of Wisconsin, Johns Hopkins, NYU, University of Texas, whatever. They're all forming psychedelic centers. They're all participating in studies with these publicly traded companies because they're finding benefit. So
this is probably a stupid question, but why did the black light in these in the wavy colors, bright colors, become such a part of that psychedelic culture?
Well,
is it because it triggers?
I think that sensory perception that there's something going on,
right?
Is it's having again experienced those things. It's
the back shelf at Spencer's. I mean, you can't not see it. It's
that's what I was going to ask. Can you take us on your most insightful trip, like something that made you a believer, as you brought that up, kind of a testimony on it?
Well, again, most of the ones that I did were, I'll call recreational.
Yep.
Because I was at concerts and things like that. Again, they don't have concerts like I used to go to.
Yeah.
Live Peace in Toronto. Gee, that's Yoko Ono and John Lennon with on stage. Oh yeah, that's Jim Morrison of the Doors up there, and Live Peace in Toronto. That one was.
You've never seen Taylor Swift though, have you?
I haven't. Are you going to give tickets to me?
Yeah, this is quite a change.
Janet Joplin. I've seen all those people. And it's exciting, and it's in a crowd that is there to have a lovely time. And, sometimes fun can get out of hand. We all know that. And we don't want to be unsafe to anybody or others in particular. But, to me, they were always centrally pleasurable experiences.
Yeah.
The hallucinogenic side of it was not something that made me uncomfortable. The visuals, the increased auditory awareness. I mean, all your senses kind of tingle
Right.
when that's happening. So it's interesting too. I mean, I would mention again that I'm working on a microdose orientation, which doesn't require as much coaching and could be used on a more of a daily functional basis. And again, there's safety concerns about all these things, what have you, and they need to be well vetted out. But, if you get up in the morning and a cup of coffee and a little bit of psilocybin makes it a better day for you without any noticeable side effects, no hallucinogenic effects, what have you, I think stimulating your serotonin pathways is not a bad thing to do.
Right.
I mean, and there's going to be more benefit, you think, ultimately than what they've done in antidepressants and things like that?
I don't think there's any doubt in my mind that the side effect profile of naturally occurring medicines is much less than some of the things that we've been able to synthesize and develop. Another funny story, because I've got a million of them. So I was in China. I was in the Yellow Mountains, and we're on a tour of some sort, and a gentleman standing next to me, obviously Chinese, but he's got a kind of a nice green jacket on. It says Eli Lilly Neuroscience, whatever. So I'm a pharmacist. I know Eli Lilly. I work for him. I've been to Indianapolis a few times. I go over to him and I said, so I saw your Lilly jacket. I said, what did you do at Lilly? I've done a lot of business at Lilly, mostly on the commercial sales, marketing, support side of it. I'm a scientist. I said, oh, really? He said, yeah, I just retired. I said, oh, okay. And I said, so what's the Neuroscience Institute, whatever? He said, oh, that's where we worked on like Prozac and stuff. I said, oh, really? What? He said, well, I'm actually the guy who discovered Prozac. So kind of a funny story, very interesting, very knowledgeable Chinese origin scientist who's in his original homeland, kind of on
real
tour.
Mellow guy, I'm guessing.
He was pretty much just like one of these guys you'd say, man, I'd love to go have a beer with you and talk about how you figured this out. So, stuff like that.
You think they figured some of this out based on some of the, like, are we doing a circle here where
it's an interesting question.
Began
it's an
from
interesting
this,
question.
And the guys copied it, synthesized it, and then wait a minute, then it got the stigma or whatever,
How does discovery happen? And there's so many pathways. Again, I mentioned that my opportunity to combine cannabidiol with lipid-lowering agents. Well, how do we get onto the fact that this might make sense? Because most people say, how the hell does that work, Jim? Well, we happen to have some people that were having some problems, back-related, muscle-related, what have you, and they had been to see traditional physicians, and the physician said, I don't know what the hell's wrong with you. Well, they'd started taking a lipid-lowering agent, HMG co-reductase inhibitor, and what they found out is, of course, that they were having the muscle weaknesses and side effects that come along with it. But for some reason, whether it's because of the disconnection in medicine in terms of information, what have you, but nobody could come up with a solution. We sent this guy some CBD. It wasn't legal at the time, but that didn't matter. We sent him some CBD. A day later, he was out back running, walking, and called up and said, what the hell did you guys just do? And we said, well, we sent you some CBD. We told you to kind of put 3 drops under your tongue and, wait a while. And if you don't feel better tomorrow, try 4 drops. And that's when we said, I wonder if a combination of CBD, and so we went out, we did all the patent work that you need to do, discovered there was a greenfield area there, and we have 2 major patents, and we'll have a lot of follow-on patents to utilize CBD as kind of an augmentation to what we currently consider to be Western medicine related. So, it's sometimes it's in the lab.
Yeah.
And you notice that, a rat responded positively to this stimulation, whatever. And sometimes with natural medicines, you're looking at somebody going, I wonder if that'd work. And when it does, you say, yeah, it must work. And so if you take a look, you'll see research from states that have authorized the use of cannabis for medical purposes, what have you. You'll find out that 90% of the people who run their surveys say, well, I take it for pain management.
Yeah.
I would say it probably must be working for pain management.
Yes,
and I don't think it's a placebo effect. So again, I think discovery is interesting. The fact that it happens, we all benefit from. I'm 73. Look at me. I mean, if my father died when he was 65 and, I'm sure some of the benefit is obviously good genetics and good diet, but I think that there's a certain amount of, how many people would be sitting here today if we didn't have mRNA for COVID.
Right.
So
On that discovery path.
Yeah.
How many people ate the wrong mushroom before they found this one? And, I've heard that some die from, you can die from the wrong mushroom.
Obviously,
but you think about the discovery of that, or like all the plants in the world, and the guy smokes pot. Like, how do you find
somewhere in our ancient first native, they figured out that there were some natural medicines that worked, and they worked effectively, whether it be peyote or whatever, and they incorporated it into their mental health regimen. And, I think that was a good thing for all of us. So
I'll bet it was like, hey, Jim, you want to come around the fire tonight? We're going to get JW to try to eat this certain kind of mushroom.
Let's go into the
see if he dies.
Let's go into the sweat lodge. And
don't get the exploding rocks, though. I've heard about that happening in sweat lodges,
You touched on it briefly at the beginning, but the future of psilocybin, it's going this tremendous movement right now because of a lot of reasons you just spoke about. How, in your mind, where does psilocybin fit in our world in, say, 5-10 years? Is it on the shelf at the grocery store? Is it always going to be at the...
While it will be decriminalized, I don't think that I should say regulatory tendencies in this country would suggest that if you're a grower, and people will grow it, that if you're a dispenser and people will dispense it, that it will be regulated. Now, so I think that will happen. I don't think you're going to get insurance companies to pay for it. In fact, I know you won't unless it's FDA approved product, because they just don't. I mean, the first criteria for any insurance company is to have the evidence that it's safe and effective, and the only way that they'll do that is through the FDA. So doesn't mean that natural medicines don't work. Again, well, I would suggest that the formulation that we've put under a provisional patent for Allied uses some functional mushrooms in it. It has what many people in the industry call a stacking orientation, where you take X amount of psilocybin with X amount of lion's mane, cordyceps. Niacin is a naturally occurring vitamin, but it helps in terms of flushing the product into the extremities, so the kind of the microcirculatory orientation. So we're going to see more of that kind of stuff done. The problem with combination products is, quite honestly, you can't find what the FDA requires in terms of certified GMP, good manufacturing process, raw materials that you have to do the kind of testing. So, the regulatory hurdles are there, but I do think that the popular interest and the evidence is going to be such that psilocybin will come back and assume a role in terms of mental health. Again, recreationally, I've done it that way, but I certainly couldn't suggest that people just wholesale go out and do that. without the appropriate knowledge.
Yeah.
I think the coaching, I think we're going to see more therapy centers. You're going to see, the wellness treatment centers and stuff. They're doing ketamine right now, and ketamine was approved by the FDA 3 years ago in a nasal spray for treatment-resistant depression. And I think that FDA wouldn't have approved it if there wasn't some evidence that it's working.
It's incredible. How many people did you say? How many people in this country are estimated with the data to use psilocybin?
Boy, I'm not real clear on that, JW. I mean, I know that, again, what the burden of illness is, but I don't really know how many people are recreationally or for medicinal purposes accessing psilocybin. Psilocybin can be accessed. I mean, Canada is a great example. Health Canada put a exemption in place so that if a physician will go through the hurdles for a patient, the patient can actually receive psilocybin under Health Canada's auspices. Of course, Health Canada also authorized for diagnosed vets with post-traumatic stress disorder a certain allotment of cannabis that they'll buy on a monthly basis. So we're not quite that advanced, but that being said, I think a lot of this research and a lot of psilocybin use happens in Canada. In fact, the University of Alberta, I would say, is kind of the academic center for psilocybin, and they're mostly getting their mushrooms out of Jamaica. There's a very big grow and types of areas there.
They have like farms there. They're like real professional.
Oh yeah. Well, in fact, they have them out in British Columbia. And the guy who started Lululemon, he and his son heavily invested into, and his son is the CEO of a company that's growing psilocybin. Wow.
Yeah.
So, it's happening.
Well, we have thoroughly enjoyed. This is enlightening stuff. Is there what was my question? Is there anything we're not thinking to ask you about this topic?
I think I went through some of the science, the regulation, the actual utilization, kind of some of the economics in terms of how this goes. There's some interest. I mean, some people are concerned that you go through 2 or 3 good journey doses with guidance of psilocybin or MDMA use, what have you, and you're feeling well enough that kind of the gravy train stops there. Right. So unfortunately, I would bet that it's going to be expensive when it comes to market. It's going to be highly controlled. I think we'll adopt and adjust to it, but with many other things, sometimes it drives people to a gray market or whatever because its costs are prohibitive to somebody.
Oh, I'm sure it's already. I think it is already happening. I've seen some documentaries on people doing ayahuasca or whatever, in like some guy's shack with a couple of beds there and trained professionals and stuff.
Sure.
And I think people are wanting to believe that this is this stuff, and so I almost invite regulation on this kind of stuff for that very reason, because passing those hurdles is really important. I think when you're getting in some dark territory here.
At the same time, access to health is important to everybody, and so
and not making sure that people are blocking that.
Right. I mean, if your insurance won't pay for it, is there something else? We have patient assistance programs for all kinds of medicines and stuff. The number one cause of bankruptcy in this country is oncology drugs that patients can't afford. So I'd hate to see it go that way because I do think there is benefit. But again, time will tell. Unfortunately or fortunately, depending on how you look at it, some of these companies are basically become patent trolls.
Oh, yeah.
So they've got 400 patents out there, from the color of the lights in the room to the color of the carpet. Things like that are kind of blocking techniques.
Sure.
I understand certainly the need to have IP around investment for protection's sake, but at a certain point, it's a little kind of out of control too.
Right. Well, thank you for the time, Jim.
Thank you.
I love
being
a couple closing
here.
questions. I'll ask one, and I'll get my partner ask the final one. But you went to Woodstock. What was your favorite band?
I think it was Joe Cocker.
Oh, cool. That must have been.
I mean, that was quite a performance.
Was that the afternoon of eating the green acid? Like, was that evening? Like, where was that in that
thank you.
sequence of events?
Rolling backwards, I'm 73. It's now 1968. I don't have a clue anymore, quite honestly.
Yeah.
But I had a heck of an interesting time. It was obviously a unique time in America, a unique time, I think, in our culture. And I think in a lot of ways, some of the stuff we're talking about does have a lot of cultural involvement as well in terms of.
Yes, sir.
Yeah. So we always ask every guest at the end, and I bet you have some doozies of answers here. Non-familial, and I would invite almost we could add as a category hallucinogenic if we wanted to open those doors, but the best day of your life.
Best day of my life.
Without family.
No family stuff, though, right?
Yeah. You can't say I married my
because everybody
wife.
knows, that would be one.
Yeah. I like getting laid, but let me think about
That's
that.
a first, but yeah.
Yeah.
Golly, I'm going to have to reflect now, which is, the best day of my life. And it doesn't always just kind of, I think it was probably when I realized that I had passed an exam and I was actually going to actually become a pharmacist because I had failed that same course a year before. But who knows? I've got so many good days in my life. Quite honestly, I feel I'm like one of the happy, blessed people on the planet, and trying to pick out the best without familial kinds of issues and stuff like that, which are always very memorable and good. But
You kind of answered. That's
that's great. Passing that test for sure.
Well, I want to thank Wayne Westphal and Nancy Westphal, who I call Mom, for introducing me to you years ago. So thank you, Mom and Wayne. Thank you, Captex Bank and Mike Thomas for this last show. You'll probably cut us off when this is aired, but we've enjoyed this, Jim. This has been very educational. Again, thank you very much.
Captex Bank must be into appropriate investments.
They're into a lot of good stuff.
If I was going to invest in anything today, I'd take a look at
one of the only two local banks here in Fort Worth. So if you want to talk, and the guy will call you back middle of the night if you have a problem. Yeah. We've tested it out.
But we're not suggesting any investments. Yeah. We're not SEC regulated. Please
forward-thinking
say that, Jim.
Statements were made here. I didn't disclose any companies that I would invest in, anything like that. So.
Thank you, Jim Smeeding. Appreciate it.
Okay, thanks, Jim.
All right. Thanks, guys. Enjoyed it.
Roxo Media House.